Hey everyone, this is Tony Mazzaferro again with the Stork Foundation, and I want to talk about another topic today. And today I want to talk about endometriosis. Now, the reason I want to talk about endometriosis is one, it's a very common condition that a lot of women experience and struggle with, and two, it is one of the more common causes of infertility. So that's why I think it's perfect to talk about it for one of these educational videos for the Stork Foundation. So first off, what is endometriosis? What does that mean? What it is classically defined as is when endometrial tissues, so the very inside lining of the uterus, is called the endometrium. Now, if those cells and that tissue ends up outside the uterus somehow, that is called endometriosis. And the reason that's a problem is because that tissue, just like the endometrial tissue in the uterus, every month it grows and then sheds. That tissue will do the same thing even outside the uterus, except this time there's nowhere when it sheds for it to go. So it can get into the abdomen and it can grow and proliferate and then shed just like a normal monthly cycle, but that causes a lot of pain. It can cause a lot of abdominal pain, and it can also cause infertility because that tissue can end up in the fallopian tubes, it can end up in the ovaries and cause problems. So it's estimated that about 1 in 10 reproductive aged women have endometriosis, so it's very common, and about 30 to 50% of those women with endometriosis will have problems with fertility. And of about 25 to 50% of women who go to their doctor complaining of infertility end up with a diagnosis of endometriosis. So the symptoms can be painful periods, painful intercourse, chronic pelvic pain, and of course infertility. Now, why does it cause infertility? We don't know 100%. There's a lot of different theories. They range from an inflammatory process that inhibits and impairs ovulatory function. Also, endometriosis can distort pelvic anatomy as it continues to grow and causes issues. But we don't know 100% for sure why. They're still trying to figure that out. So for women who get the diagnosis of endometriosis and are struggling to become pregnant, what can they do? So it's actually pretty similar to the treatments for those who have infertility for other reasons. The treatments are, for mild endometriosis, the treatments would be more conservative treatments like IUI, like I talked about in a previous video, or ovulation induction medications, or those with severe endometriosis that have lots of implanted tissue outside the uterus. They usually will go straight to IVF to help with that in that case, because usually it takes a little bit more for them to get pregnant. So I hope that makes sense. So in summary, endometriosis, endometrial cells end up outside the uterus. They can actually end up all over the body. It's kind of interesting, but most commonly in the abdomen, fallopian tubes, ovaries, cause problems and cause a lot of pain. But thankfully, with advances in technology like IVF, IUI, and these ovulation induction medications, they can still help these women get pregnant and that they can have families, thankfully. So thanks for watching. I hope you learned something, and I'll see you next time.